we'll get started. I'm Celeste Clark, the director of the Raymond Coalition for Youth, and I want to thank all of you for being with us today for our, May coalition meeting. Again, looking forward to going back to in-person meetings with all of you, but we're doing what we need to do right now, right? And I'm excited that you're all still coming to the meetings so we can learn and share resources. Thank you for that. If you could put your name and the organization you're with and your contact information in the chat box, so we can, if anybody wants to get in touch with you or learn a little bit more about what you have going on, that would be great. I was in a meeting the other day where somebody did a popcorn activity, and I thought that was a pretty neat way of introducing people, but a lot of people don't know each other here, so we won't do that right now. We'll wait to do that at an in-person meeting, right? So to kick off the meeting, we had a pretty exciting month in April for the coalition, and we just wanted to reflect upon the importance of celebrating what we have going on, because all too often we all get caught up in the work that we're doing, which is really great work. And then we forget to stop and realize all the great things that come from that work. So I had put together a sheet, and I'm just going to share it with all of you. All of the things that happened for the Raymond Coalition for Youth in April wouldn't have happened without the people who are involved in the work that we do. We were featured on the front page of the Sunday newspaper for the work that our youth action kids and the community did around the vote that was taken in Raymond to put a ban on marijuana shops coming to Raymond. We were the first community in the state to do this, so that was pretty exciting. We collected 335 pounds of medication at the Take Back event. We had a statewide ad on the back page, in the Union Leader, around 420 for marijuana prevention and encouraging people to talk to their young people in their lives about marijuana prevention. And then we had a meth flyer that went out to raise awareness to people, to share that information. We also shared a story yesterday of a dad in Georgia, I believe it was, who lost his daughter to a fentanyl overdose and from a prescription drug pill. So getting that information out into the community is now more important than ever. So it was a really successful month, and we just wanted to highlight that and make sure that obviously celebrating in person is far better than celebrating on a screen, but still it was important to make sure we recognized all the things that happened. So thank you all for that. With that, does everybody hear that feedback? I don't know where that's coming from. Zoom. I want to introduce Stephanie Wright, and I hope I say it right, Sarah Freitas, is that correct? From Sequestered Youth Services. They're joining us today to talk about some of the services they offer over there that we can potentially take advantage of here if need be. So Stephanie, thank you so much for joining us this morning, and I'll let you take it away.
Okay, thanks for having Sarah and I on this call. So are people familiar with Sequestered Youth Services at all? Like raise hands or, yeah, Nicole. So Sequestered Youth Services, we're a nonprofit in Seabrook, New Hampshire. We've been around for, I guess, over 20 years now. But we kind of have a continuum of care: prevention, intervention, and treatment. So we do positive youth development programs in the local middle school, summer camps, all the way to treating co-occurring disorders in our intensive outpatient program. So for today's information, I invited Sarah Freitas, who's the director of the outpatient program for adolescent co-occurring disorders. So I thought she could speak about that and kind of what the program looks like and where referrals come from and how you all can help spread the word. And then also we work with court-involved youth and families. So Nicole Jordan, that's how we know Nicole, because she'll send us referrals. So I can touch on that, but first I'll let Sarah talk a little bit about our IOP and what that looks like.
Okay, so the IOP is for adolescents that are high school age. That's usually a frequently asked question. Technically, I think we say like 14 to 18, but the real criteria is that they're in high school. We want to be really careful not to mix, ages that are not appropriate to be mixed with one another. But and co-occurring, so substance use and mental health. We see a broad range of substance use and mental health disorders. So another frequently asked question is kind of like, how much substance use does the individual have to have? Is there kind of like, and the answer is just a history of substance use. And it can be is that primary or not diagnosis. So that's pretty broad. It's a 10-week program, and we see the adolescents in a group format 4 times a week for 3 hours a day after school. And we are DBT based and have a really strong mindfulness sort of curriculum. And we also have an adventure based piece of the program, which is now ramping up, and we're putting a stronger emphasis on that probably than ever before, just to reconnect youth with healthy coping skills and just positive connections, getting out and really having experiences. So we're a hybrid right now, and we are going to remain a hybrid through the summer, which is partly obviously due to COVID, but also at this point really to provide more access to treatment, because we experienced one silver lining of COVID was that we were able to provide treatment to kids a bit further away through Zoom, obviously. So we had kids from like Vermont and farther up in Maine and up north New Hampshire, which typically is a barrier. And so that was kind of nice to be able to take that barrier out of the picture for a little while. That might have been the only silver lining of COVID. But so with that in mind, we've always been quite aware that there are no other IOPs that are co-occurring for youth in or that I'm aware of. So correct me if I'm wrong. If anyone knows of any, please tell me, because I'd love to refer other people to them. But it really became more evident than ever that there's a lot of kids that don't have access to treatment. So with doing hybrid, we're hoping that even the youth that are a bit further away may be able to swing that commute if it's only twice a week as opposed to 4 times. So on Tuesdays and Thursdays, we're in person, and Mondays and Fridays, Zoom. And as I mentioned, the adventure-based piece is really important for us to not just talk about healthy coping skills, but to actually model them. So you can tell kids like all day long how good a hike might feel, but unless you drag them out on the mountain and do it with them, they might not do it. So we do that. We have a lot of really great community connections with people that give us opportunities with the kids. So we do art-based therapy. We've brought them indoor rock climbing, hiking, really just trying to utilize our community supports. The referral process is pretty straightforward. Actually, just call me and I'll get them in. A lot of people ask, like, can the parent call? Does the therapist have to call? And the answer is literally anyone can. A parent can just pick up the phone and call, and we can talk about if the youth sounds appropriate for the program, and then we schedule an intake. And that's kind of how we get started. And I typically am able to get youth in pretty quickly, like within 1 to 2 weeks. So we get a lot of referrals from hospitals, youth stepping down from a hospitalization, whether it was a primarily mental health hospitalization, like their suicidal ideation or suicide attempt or something like that, or if the hospitalization was primarily substance use. Like I said, either way. And then we also get referrals from the community, therapists who say, I'm seeing this youth that needs a bit more. We also get referrals from juvenile justice. So we have some kids that are court ordered to the program, and it is a voluntary program. So in order for youth one of my taglines for the court ordered kids that Nicole probably knows is that the judge can court order you to be here, but I'm not court ordered to keep you. You have to be willing, right? And most of the time they are. Once they get here, it's not what they think it's going to be, and they find that positive connection with kids that have been through similar things. So, and we also have a parent group. And just a piece about that. The parent group is Tuesday nights at 6 o'clock on Zoom right now. And that actually is a free group and open to the public and drop-in style. So I sometimes have parents call and ask about the program, and maybe their youth isn't willing or whatever, but I tell them about the parent group, and I'm like, I can put you on the email list. And so anyone can come to that. And that's a really great resource for you guys have. If anyone has any questions about that, or you can always reach out to us, but anyone can come to it. It's just not everyone knows about it. So that's my I'll try not to take.
I would say it's virtual now, and that's been somewhat of a silver lining because parents are able to access it where they don't have to drive here. And then, you know, at end of day, it's really hard for parents, obviously. So that's helpful. That's been helpful to have it. Zoom.
Yeah, that was a barrier, right? Like parents that didn't have childcare for younger children or work schedules. I think we had people kind of even like Bluetoothing in on their commute home from work. So I think we've had a lot of the attendance has increased for that. Does anyone have any questions?
Just for clarity, IOP, intensive outpatient.
Yes, intensive outpatient.
Just wanted to make sure. How is the attendance at the parent meetings?
Really good now. You know, I think when it was, so it used to be, we had it structured prior to COVID that parent group met at 5 on Thursday nights, primarily because the youth in the IOP ended at 5:45. So our thinking was like parents get here and do the parent group from 5 to 5:45. And then when parent group is done, the IOP is done for the day and they all leave happily together or not. But that was really tricky, that 5 o'clock time. So we've really shifted our thinking around how we can, again, provide access to that group to others. And so that's why we shifted the time. And Zoom, I mean, it's likely that we'll keep that as Zoom. You know, we've talked a lot about what that needs to look like when things go back to in person, maybe keeping a Zoom, and if we do in person, maybe doing 2. But it has actually been really great attendance, and the parents really enjoy that.
Something that we could share for people to go to?
Absolutely.
Absolutely. They just get added to an email list. So when we have an email, we can just send it to the facilitator and she'll include the family parent on the invite. So that's how it works right now. Until we come up with something better.
Right.
So we have a few people from the school on the call. Do you have, is one of your programs for referrals from the school if children are in trouble or get caught with substances at the school? You still offer that program?
Yeah, well, we didn't this year because they weren't in school, so they weren't getting suspended. Right. But so that is our that's ASAP, the Adolescent Substance Awareness Program, and traditionally that has been a buyback program. Although we've it's a couple of things actually, but we are contracted with Winnicott and Exeter High School. So if they have a youth that has a substance use infraction and they get suspended for 10 days, they can buy back 5 of those days by coming to 5 sessions of ASAP. So they don't have to serve the full 10 days, which is great. We also have had some referrals, some actually like juvenile justice referrals that maybe, I think, and Nicole, you can clarify my language maybe, but it was like kids that didn't get on probation, but did get, like, I think we had a couple of kids that
we had one from you, Nicole. We had one from you recently.
Oh, did we?
Yeah. Yeah.
We sometimes we'll divert to you guys.
Yeah.
Like,
Yeah.
Found they're not on probation, but obviously use you for a zillion resources, but for like placed on file cases.
Right. And then the only piece about ASAP is if we're not, so like Exeter and Winnicott, they fund that, so they pay for their kids to come here for that buyback program, and otherwise, so ask question 2 for IOP, we accept insurance, and pretty much all insurances, so that's how that operates, and ASAP is a little different. So I did have one youth that was suspended this year, and they called, and they were like just recently, and they were like, "Are you guys doing ASAP?" I'm like, "Not really, but we can figure it out." So she came to, we just worked it out, because a lot of that we put them in with the IOP on the days that the curriculum is more heavily substance use, and we just kind of like operated that way. So we were able to get her in and just kind of get creative, which worked out well.
that the program that you offer? So if you contract with the school, then there's transportation provided with that also, with the ASAP
Mhm.
program when it's running?
Mhm.
Yep. Yeah. And historically, we have provided transportation for IOP as well to the program. And then everyone has to get, their own ride home. But that was our efforts to eliminate that barrier, because a lot of parents could not get their kids to an IOP 4 days a week at 3 o'clock. So we have historically always provided transportation. Right now, we're just kind of, we're trying to get back to that, but we're asking parents who are able to provide transportation just to kind of minimize the risk. But we won't kind of let that be a barrier for those.
I was just thinking too, Sarah, another thing that you're starting back up now that you're moving hybrid is the drug screening component of the program.
Yep. So we do drug screens in the program. We use a lab, and we do that weekly. And yeah, we weren't able to do that during COVID. So kids are super excited for us to start collecting their urine, and I'm sure. But we're kicking that back up next week. So.
But to be honest, like in the past, like where we struggle in probation, kids obviously don't want to take drug screens for us. They want to take them for you to show that they're clean, and they get incentives for it. So I feel like you guys do a much better job, you know what I mean? Like that with that incentive-based positive reinforcement, or for us, it's more, okay, good, you're doing really well. You're not going to file something with court.
Right. Yeah, I appreciate that. That we've worked hard to create the incentive-based program. So we, they get rewards like small denomination gift cards or like prizes and things like that. We also, it is different because we keep their drug screen results confidential for most kids. Some really high risk cases, I have them sign a release that if in order to be in the program for like liability and safety reasons, I need to be able to share their results. That's if we have a really high risk client come in where I'm like, this is, we would need to have that transparency. But because it's a therapeutic program, we don't share the results with their parents or sometimes their POs, again, unless we kind of write that into the agreement of them attending. And so it kind of has a different intention to begin with. It gives us clarity and a little bit more transparency, but also they know that they can talk of this is, we're not here to get them in trouble. We're here to kind of get a better picture and build their insight. So yeah, we don't typically have too much pushback.
And I would say with the lab screening, it's nice because you can actually see the THC levels go down, for example. So it's not just positive or negative. So it might still be in their system, but the level of use has decreased. So the youth can actually see that, right? So it's
yeah. Or for the youth that are like, I smoke like once a week. I'm like, so
not according to
not according to this. So it helps to kind of like, it's like, let's get honest.
Right.
Anybody have any questions for either of the ladies?
I did. I know you mentioned insurances. Do you accept Medicaid or any of the MCOs?
Yep, we take New Hampshire Healthy Families and WellSense, and they cover the program completely with no out-of-pocket costs. And some of the other insurance, I mean, we pretty much can take any insurance because if we're not paneled with them, which we are paneled with most, if there's something that we're not paneled with, they usually give us a single case agreement just because there's they have to because they can't be like, oh, they can go to this program that we're paneled with. It's like there aren't any other ones, unfortunately.
Right. Do they also would they ever provide transportation to those appointments?
Sometimes, yeah, actually. So we try to avoid that only because like I don't like putting kids in cab. Safe Passage is one thing, they're great. Cab companies can be a little, so insurance will sometimes cover like getting the kid home in a taxi cab. We have one company, ABBA, if anyone ever needs a cab, they're great, who we trust and have worked with in the past when we really haven't been able to get a kid back home after the program, but otherwise we try to.
At a Seacoast taxi area or ABBA?
ABBA, ABBA. Yeah.
Okay. Seacoast. Thanks.
I think it's Seacoast.
Thank you.
And we do, speaking of payment, so there's insurance, and our motto is whatever it takes. So we try to be creative and figure things out. And also with probation, Nicole, Jordan, we have you through probation. So in-home services can pay for that as well. So we can tap into a variety of resources to work with youth and families. So maybe probation refers to the IOP that way.
Have you seen an increase in cases recently?
Yep. Yeah. And, I think part of it too is that there's just like a bottleneck everywhere. So we were seeing an increase in cases to begin with as soon as COVID started. But also there's a backup at like Hampstead Hospital or there was, I don't know if there is right now, but there was a little while ago, lots of kids sitting in ERs. So, I'm sure everyone's heard that that's kind of like a huge problem. And so we're getting kids, that's a bit of the challenge, is that some of the youth that really should be going to an inpatient hospitalization are they're trying to get them in here. Not always, we have to be careful that this is the right level of care, but we're trying to also help kind of alleviate that crisis in itself.
We've had situations where this youth is stuck in the hospital until Sarah, you can get him in an intake. So, then Sarah's like, okay, how quickly can I get him in? So he's not sitting, in the hallway of a hospital or not having a place to be. So, yeah.
I'm like just about to have a bite of my dinner. And I'm like, oh, let's do an intake.
And are you allowed to share, and you may not be, what are you seeing for the substances that the kids are struggling with now?
Oh yeah, no, THC is like the frequent flyer. That's been the case. It's increased over time. I think now that, all the kids have access to dab pens, and that's always been the case. Xanax is a pretty consistent, it's, been kind of running rampant through the high schools for the past few years. Alcohol is not as much, it's just harder to get alcohol than it is to get like a little pill or a dab cartridge. So, and then the gamut of other things, the DMX or DXM, Robitussin, like just kids getting creative with the medicine cabinets, parents' pills and prescriptions.
So we've heard that from other schools also that I work with around the state about the Xanax, and that's really concerning. I don't know if you've heard from the DEA about the meth flyer that I had mentioned earlier, that they're the pills now that the kids can be buying on the street, the majority of pills that are being confiscated are laced with meth and fentanyl, and they look just like Xanax and Adderall pills. So pretty scary.
Yeah, it's very scary.
Any other questions for these ladies? I feel like you're like a hidden secret over in the Seacoast.
Yeah.
I don't know if you want to stay hidden or.
No, that's one of our goals, is to be increase our visibility.
I can't sing. I know that on my counterparts to it, we can't say your praises enough. You are definitely my go-to. Pretty much, I always make my referrals to you guys, and you're very accommodating. Whatever kind of issue I have, you guys always figure out a way to make it work. And if there's a lack, and I know Vic's not here, but if there's a lack in something, a service, you guys are always looking to figure out, what kind of program you need or to meet like what we're looking for. Honestly, if you have an issue, like that would be where I call to, but don't overload them because I want to use them.
we're getting a wait list now, so.
No, I have to make them today.
All these truancy cases, Nicole.
I know, that's really what we see now. It's all true.
Yeah, truancy, big time.
Mhm.
What do you do in the case of truancy?
So we receive referrals from DCYF and juvenile justice. So it's in-home services. So there's different levels. So it looks like 2 to 3 times we'll go out to the home, meet with youth and family, and obviously truancy. There are often, or most often, or if not always, other things, family dynamics going on that's preventing the youth from getting to school. So. But yeah, this year it's really challenging because of the remote. Kids haven't been in school for a whole year. But yeah, we incentivize it. We might help transport the youth, morning calls, case management, wraparound meetings with the school. So we try to get creative, and also connection, getting youth engaged in activities. A lot of them have been hanging out in their room for a year. So.
How is that paid for that particular piece that you do?
Through the state. So we get authorized, so we will receive a referral from, say, Nicole, and then we'll do an intake and then send it to her, and this, I don't know, the back end fiscal of the state authorizes a service and we get paid for that service. So we're contracted with the state. But the school, if the youth isn't going to school, the school can file a voluntary CHINS or a CHINS petition, right? And Nicole, if you can speak to that. Is it volunteer when the school does? I don't know
I don't know how we get there, but you get it. No, so so what would happen? So for a CHINS for truancy, the school district, a parent, and the police department can file. Which they don't typically do, but we have gotten quite a few. We're kind of getting inundated, either from school departments, when kind of it's on top of it, and all the other ones are kind of picking up, figuring out the end of the year stuff where like we have kids that haven't attended at all.
Right.
So what happens is they call central intake, and it gets referred to. Depending upon the age, it'll either get referred to myself, 12 and older gets referred to juvenile justice, and younger would be referred to protective. I see Carrie's on. So then we would go out and meet with the family, either with COVID, either by Zoom or telephone or face-to-face. Usually it's face-to-face now. And have a conversation about, school attendance and what's the barriers and what's going on. And then they can voluntarily accept both the youth and the parents have to accept the voluntary services. We write up a little contract, and then we make the referral for those in-home services. Typically for about 90 days, original. It can be longer. We can extend that if it's being successful and helping. If that works, then they start attending, and after that 90 days, we reassess, and if we either continue on with that or we've successfully closed it out. If it's something that doesn't work, then we can close the voluntary piece, like either like the kid decides, I'm not doing this, I don't engage, we give whoever called central intake a letter, and they can file it with the courts for an actual CHINS petition. Letter's good for a year. Did that help? That's kind of in a nutshell.
I think I just know that I'm on the school leadership team, and truancy is one of the things that we've been trying to look at and trying to find a solution to. So this is a resource that we can use to help the school. That would be great. And if that the cost, obviously, I want to make sure that see how that's covered.
Voluntary CHINS are free. There's no cost
to the family.
To the family.
Free's a good word, right, Tina?
Yeah, and we also try, one of the goals is to connect families to long-term supports, right? So it is 90 days. We've had ones that go like a year, but it's typically pretty 90 days. And then we really try to connect them to the longer term treatment. Yeah.
Yes, because we certainly don't have, you guys don't have the manpower for like an entire school district, so, you know,
Oh, no.
and C's, like we need to come up with longer term solutions, right?
If we get more, Vic might be like, we should open up a school.
Right? That's, I can see Vic being like, that's a good idea.
Yeah, exactly.
Maybe it's a good thing he's not on the call, right?
We
Yeah.
sometimes prefer him not to be, actually,
Yeah.
because then he'll start, we're like, stop talking. Oh my gosh, stop talking.
I'm in the
You're
background,
like,
we're like,
"You do
no.
His wheels start spinning. You're like, oh no.
I have to jump off, but I want to thank everyone for having us here. And if anyone has any questions, please just feel free to reach out, give us a call, send an email. Even if you have like a case that you're not sure, I'm always happy just to like have a like, you know, consult. So
Thank you so
Yeah.
much for joining us and all the information that you shared.
Yeah.
Really appreciate
Thanks for inviting.
yeah, thanks for having
Absolutely.
us.
Thank you. Have a great
Bye.
day, ladies. Thanks.
Bye.
Bye-bye. Okay, that was a lot of information, a lot of good information. We'll move on our agenda. I don't know if you have an agenda. It is on our website. The next thing is Operation Raymond Cleanup. It is definitely different than in typical years. The town has some COVID things going on with the bags, the blue bag program that we typically use. And the schools are like super busy with just trying to manage COVID students and graduation. So things are a little bit different this year. We decided that we're not going to do a year-end event with the high school because it's just too much at this point. But like I'm working with the Junior National Honor Society at the middle school, and they're going to be going out and hopefully doing a cleanup at a time that's convenient for that group. So we're working with groups to see who can go out where and tackle what. And the blue bag program is obviously available for anybody in the community who's willing to do their neighborhood also. So a little bit different this year, but still happening. If anybody has any questions on that? No, okay. Youth Action is back up and running at the high school, which is very exciting. I don't know if some of you may not know Christine, who was with the coalition, has chosen to move on to different avenues. So she's not with us any longer. So at the moment, Youth Action at the middle school is not happening. We hope to have somebody in that position. I'm working with, again, the schools on some intern options and some coalition options for the fall. We'll start that group back up again. But currently the high school is meeting and in person, which is very exciting, with masks on. And the kids have just been amazing. We're working on Mental Health Awareness Month, and I'm going to share my screen, hopefully, and show you. This is the design that they came up with. The message, you are not alone, getting that out to the kids in the school, the teachers, the staff, their parents. The kids felt like this was a strong message for everybody of all ages to really see, the reach out that people are here to help. We're putting together a resource sheet. We have funding from the Seacoast Public Health Network, and we're putting wellness bags together that are going to have little trinkets in it, information for where to go to support. So if any of you have any information, Chris, I don't mean to call you out, but driving safety or something like that you want to go in the bags. I mean, we have it broken down by elementary, middle, and high school age. So if you have information that you want to go in a certain pocket, we can definitely do that when we're putting them together next week. So again, it's just a great way of giving the kids some resources and making sure that they know that they're not alone, that there are people in the community who really support them and their well-being and the importance of mental health right now. I feel like we're all excited to come out of COVID, but at the same time, there are a lot of people who are still really struggling with the impact of what COVID has given us. And I don't know if anybody has any questions on that.
Celeste, could you just repeat who you have the funding from?
Yes, Seacoast Public Health Network has provided some of it. And then I'm working with Jess with the AWARE grant that the school has. So we're combining those resources together so the Seacoast Public Health Network was giving us funding to do the high school only. And Jess really liked the idea of really getting this message out into the whole district, which I love that idea. We just didn't have enough funding. So we're braiding the funding together to have a unified message.
Great, thank you very much.
I know Lamprey Healthcare is putting some things in the bag. Seacoast Mental Health is putting some things in. There was some Connors Klein. If anybody is aware of that organization, they do suicide prevention. They're going to be providing some stuff. So it'll be a nice little, like a gift bag. One of the girls said at the high school, it's going to be like going to a birthday party when you were young and you got that great gift bag to leave and go home with that you were so excited to go through. So it's nice that the kids are excited about something like that. And again, getting information. We have a resource sheet, which I think I can share that also. I cannot forget that, but it's a resource sheet with all numbers on it of area, like sexual assault support services, domestic assault, suicide prevention. So if there's a certain resource that you know of in the community that you think should be on the sheet, please do share that as well, because that will be going out with all the kids as well. And again, just a touch point, we haven't been able to do our typical engagement with the kids in the building over the year, getting information to them. We are doing, if you've heard of Chris Herron, he's a former Celtics player who struggled with addiction. He has a film and we showed that to 7th and 8th graders. Brianna, who's on the call, she helped organize that at the middle school. And we're doing that next Friday at the high school. And that's talking about suicide prevention, substance misuse. So having those conversations with the kids. Any thoughts or questions on that? No. We just wrapped up our first spring online auction to benefit the coalition. If you saw any information about that, a lot of people had a lot of fun and it raised some money for the coalition. It raised some awareness to the coalition efforts. So overall, it was a great success. Not as profitable as our typical gala that we have in the fall, which is in person and seeing everybody, but still it was an opportunity for the coalition. So thank you to everybody who supported it and was part of it. And if you won any great little, if you were the highest bidder on any of the items, congratulations. Next is the disc golf. If some of you might know, we're working with a family in the community to open up a disc golf park up at Riverside Park in Raymond. And there's been a ton of volunteers out there doing a lot of work. We hope June or July we'll have an opening date. We're having a meeting next week to discuss setting a date for that. Because some of the supplies and things that we need to get the park finalized, of course, if any of you have done any building projects or anything, ordering supplies, everything is kind of very slow right now. So those are some of the things that we're running into as we're approaching the final steps of the park, but it is almost done. So that's very exciting. And does anybody have anything else that they want to share for an update? Your organization? You're very quiet today. Yes, Chris.
Yeah, I'll just give it a quick update. May is Youth Traffic Safety Month nationally, and I am coordinating the 2021 Safe Driving Media Contest. It's been happening through the month of April and continues in the month of May. So if you know of anyone that's interested, I know I've sent along the flyer to you, Celeste, before, but it's on the website, the Teen Driver website as well. So we're happy and excited to have, we've gotten 3 results, 3 entries so far. So I'm hoping for some more. But yeah, and I will get some information for you for the packet as well.
Awesome. Very good. Thank you. Any other updates? Pat, do you want to share about the video at the middle school?
Sure. We're working with the coalition to hopefully get a PSA done about what wellness means to the kids there, to be submitted to the United Way Film Festival, or approximately what the film festival will be this year, given all the restrictions. We have a couple kids who have permission from their parents to be in it. One of them was very funny. They just sent me an email saying, "I give permission for you to use my child in commercials." So we're going to be working on that, hopefully getting that taped by the end of this week and sending it over to Celeste for editing from, you know, the experts of that kind of stuff, and have a nice little PSA to go out.
Thank you very much for jumping in so we can have something to submit for that.
Yep.
would just add one thing. I want to say, just appreciate your understanding in terms of the cleanup day. We love that event. I mean, we think it's one of the greatest events of the year. We really want to do it, but there's just been so much going on, and kids have missed so many days of in-person learning, and it would just be very difficult to, have another day off. So we're looking forward to the event in the future, and making it just another annual important tradition for us. So thanks.
And the school is really trying, and I felt so bad for them the other day. We had a meeting with them. I'm like, we don't have to do this. And they just looked at me like, we don't? I'm like, no, we don't have to do this. I didn't want to put one more thing on them because they just seemed like they had like one more thing too many already. So pushing it off to next year was the obvious thing for us to do.
Yeah.
So
Well, thanks for your understanding. And I know that I talked to Steve, and he wanted to make sure that everyone knows that they really, really like this event a lot, and that's not it at all. So thanks a lot.
definitely know that. So thank you, Tina. For anybody who hasn't heard, Tina, can we share your information? When did you share it the last time?
Oh, we did last time.
Yes.
I don't know if that's very interesting to most people, but
we're going to miss you very much. That's how Tina's moving on. She's retiring. So we wish her well, and we will miss her.
thank you. I really appreciate that. And this group is amazing, and it's a wonderful thing that most communities don't have. So keep up the good work with networking and just staying in touch. So thank you. I'll still get your emails. I noticed I get your emails on my other email account. So like I said, I'll creep on you a little bit that way.
There you go.
Okay. Thanks.
Very good. Okay. Anybody have anything else? Kim, do you have any updates for us on vaping? I know that's a very, very big thing at the school right now. I've heard a lot about that just in general in the community. Obviously, the ladies shared a little bit about vaping too. So
yeah, it remains kind of an unknown with less interaction with youth in general for across the country. We've heard mixed things. We've heard more kids have tried it because when they were allowed to hang out with friends, that was one of the things that might have been done. The concern is that the kids that were already vaping may be vaping more because of the situations, the anxiety, the stress in general for everyone. So it's gonna, the YRBS that's done usually every 2 years was not done. It would have been done this past May, wasn't done, or this month. So we're gonna be kind of off a year, but there's some new products on the market that use synthetic nicotine. They're of concern because no one's too sure federally and regulatory. They're not sure what's in the synthetic nicotine other than it is as strong as regular nicotine from plants. But you're adding another chemical-based product. It skirts federal regulations because federal regulations are defining tobacco products. They don't include synthetic nicotine. It's in dissolvable forms, it's in vape forms. So that's kind of a thing to kind of watch and learn a little bit more about. And it is offered in flavors. So again, flavors attract people of all ages. And it makes it a little bit easier to initiate trying these products because it covers up masks the chemical taste. So that's kind of a concerning thing right now. But thank you, and appreciate you guys all sharing your information. And good luck, Tina. I didn't realize you were leaving because I missed the last meeting. So
Thank you. Thank you.
I enjoyed working with you at our organization too.
Thanks. I really
Thank you,
appreciate
Celeste.
So I will mention, I don't know, because it was newer for us to realize, smoke buddies have been a way to get around our alarms at the middle school. So if you don't know what they are, you can literally look it up online. It's like a little box, and they breathe in the smoke into it. So the things aren't able to recognize the smoke in the bathrooms. So that's one of the newer things that the kids have been using here.
you would have no idea what they even are looking at them, unless Brianna sent you a paper to see what they look like.
Oh, and that's why I wasn't 100% sure. I knew what it did, but I didn't know the name of it. So, and it's like, it has a piece at the top and a piece at the bottom that you breathe into, and it just like funnels out the smoke. It's really geared towards kids. If you look at the website, literally it's like smokebuddy.com or something, and you can get them on Amazon. They're literally just like look like a toy. So
Thank you, Brianna. Christina, would you like to share an update? I noticed you put something in the chat.
Yeah, sure. My video isn't on because my Wi-Fi has been terrible, so I apologize for that. But yeah, just wanted to let everyone know that we still haven't seen any movement in the state Senate to add tobacco prevention and cessation funding. So right now there's $0, like no money at all. And so that's concerning. Some folks did testify about it at the public hearing last week. But we know that they're still under consideration. So we're launching a campaign at New Futures to make sure that folks are calling their senators directly. It would take about 10 minutes to call these 5 folks that we think we can push on this issue, and would love to have anyone's support on that, especially folks like you all who work really closely in prevention work. So if anyone's interested, you can send me an email, or if you want to share information with your networks about that, I have a lot more information I could share with anyone, but would love to have you support us on this.
I know that 2 groups that I'm a part of, the New Hampshire, the Governor's Commission Task Force and the DFCs, I know that we've been sending information, drug-free communities have been sending information advocating to support the tobacco prevention and cessation line.
Cessation? I know I never say the word right. Yeah, well, that's great. Thank you for that's great. Thanks.
One little, like a nice little story is we put something up, the 1-800-QUIT-NOW line on our Facebook page a while back, and somebody like put a rave review thanking us for sharing the information. They called, they got a great response, they got patches, they got all kinds of support to help them quit. So they were very excited about that. We have to share those good stories, right? When the program works. Okay, if nobody has anything else, I guess hopefully you can take some of the time that we saved in the meeting and go for a nice little walk outside, because it's so absolutely beautiful, and invest in your mental health for the day, right? It was great to see all of you. Thank you. Bye-bye.